I chose the University of Florida Internal Medicine program because it felt like home to me right off the bat. I feel like everyone here, from all the residents to faculty to program leadership, exudes such a welcoming and close-knit vibe, and it was just like a family I wanted to be a part of.
I chose UF Internal Medicine because of the great leadership and mentorship offered by our attendings. I wanted to be in my weekly continuity clinic attending. I built a strong relationship with her, and that she's able to just kind of get to know me as a person, and she sits me down at the end of each clinic asking me, like, how are you doing? What went right? What's some things that particularly weren't going right in your life?
I chose UF specifically because I really wanted a breadth of clinical experiences. Essentially, we see a lot of high acuity patients. We see a lot of varying diagnoses. Some diagnoses that up until the point I got here, I really just saw in textbooks. We also work at VA hospital. That kind of helps us form a really good foundation.
I'm originally from Virginia, but I think I was really drawn here to Florida because of the small town feel, but still having plenty of diverse activities. We have a lot of outdoor parks, as well as the natural springs for things like tubing and kayaking. And I like that it's still a college town because then you have all the sports and things that come with that.
There's an abundance of research opportunities here at UF. There are faculty experts in every subspecialty who are extremely passionate and willing to involve residents in their research projects. It's also very common for residents to approach faculty with our own research ideas, who will help guide us into turning it into a QI project or original research project. Within a few months of me arriving here as an intern, I got looped into various oncology projects that various current residents were already working on. And now as a second year, I'm now working on my own research projects, and I'm paying it forward by involving some of the current interns.
So each resident is paired with one continuity clinic attending. This attending follows us all 3 years. We're paired with a panel of patients. It's usually around 40 to 50 patients, where we follow these patients all 3 years of residency. So we are basically taking charge and taking ownership of these patients. We are their primary care doctor.
So the leadership opportunities here at UF Health are pretty varied. So you have the House Staff Advisory Committee. So you can be a representative for your class, where you're meeting once a month with the associate program directors and the program director to give some feedback or areas of improvement that you get from your classmates. We have the Gator Council, which essentially is 4 different councils. So that includes the Curriculum Committee, the Quality and Efficiency Committee, the Wellness Committee, and then the Research and Board Prep Committee. And it allows us to really kind of tailor our experience and make quick changes to the program to have the best experience we can possibly have at UF Health.
I think someone should consider this program because we really have it all, in my opinion. We have the patient load, the diversity of cases, we have the collegiality among each other as friends, and I think Gainesville is an awesome place to live.
I absolutely feel like my training is going to help me become a good doctor. It already has so far.